Thank you very much. The Prime Cabinet Secretary, His Excellency Musalia Mudavadi, the Governor of this great county of Vihiga, Your Excellency Governor Otichilo, the County Commissioner, Mr. Kitio, partners present, area MCA, the Chair of the Hospital Board, together with your board members, management and staff, and all stakeholders of this hospital, ladies and gentlemen, good afternoon. Murembe, Muribalam, Asante. Indeed, it gives me great pleasure to join you, Prime Cabinet Secretary, and join the hospital on this auspicious occasion of the launch of their pediatric unit together with the training center. And having looked at it, this is a center that is going to serve not just the people of Vihiga, but far and wide in the country, as it forms a major cornerstone of the specialist eye hospitals that we have in this country. Prime Cabinet Secretary, there is a rapid assessment that is ongoing on avoidable blindness. And currently, the statistics as at December 2022 indicate that 4 out of 1,000 people in Vihiga County are at risk of blindness, yet these are treatable conditions. PCS, this translates to about 2,500 blind persons in Vihiga. In that estimation, we can project up to 200,000 Kenyans that are at risk. And therefore, I'm so happy to stand here and support this facility in the endeavors they're putting in to ensure that we are able to manage eye diseases in this country. We need to understand well that although you may see about 15,000 children blind in the country, them living with that disability is a huge loss to this country on matters economy. And you know, PCS, as a country, we are in a difficult space, a difficult physical space. So we have an opportunity to ensure that each and every Kenyan is productive. It is sad that blindness at times causes stigmatization and social exclusion and eventually depression of blind adults. And obviously this lowers their morale and participation in other activities within the society. PCS, it is known that early identification of the child with blind eye disease or even sight-threatening diseases is therefore paramount to achieve good treatment at an early stage so that we get good outcomes. It is therefore my passionate appeal to all of us to proactively look for these children in our community in the earliest possible opportunity. And PCS, this falls in line with what we are doing at the moment at the Ministry of Health. On several occasions, I have told Kenyans that as a ministry, we are now not focusing on curative services only, but we want to give emphasis to preventive and promotive healthcare. And to achieve that, we are going to launch over 100,000 community health promoters. And in my discussion with the governor early in the morning, he told me that in Vihiga, he has over 1,500 community health promoters. Tupigie Governor makofi. And I want to assure you, Governor, that we are going to work with you. In a month's time, I'm going to bring gadgets like this one I'm holding for your community health promoters. In a month's time, Governor, I am going to bring you a kit for your community health promoters. This kit is worth 45,000, Governor, and it has the basics that they can use when they go into a household. My plan as the Minister of Health is to ensure that one community health promoter is actively looking at 100 households. Wako na kit ambaye nitawapatia. Katika hiyo kit kuna weighing scale, wakija kwa nyumba wanapima, wanaona kama mko sawa sawa uzito wenu. Katika hiyo kit wanapima pia kama kuna mtu akona ugonjwa wa kisukari, ili wakaweze kumwelekeza hospitali. Hawa wataweza kufanya the basics within the household. Pia wataweza kuelimisha jamii mambo ya nutrition. Wale vizuri, matunda, mboga, ili kuhakikisha afya yao iko nzuri. These community health promoters are then going to feed into community health units. And these community health units will then feed into what we call a primary care network. And I want to thank the Hospital of Sabatia Eye. You are ahead of me. Because from your explanation, on your board, you have a community representative, you have partner representative, and you have your technical people on that board. That is what we are envisioning for the primary care network. So that if the Vihiga, if the Sabatia sub-county is the headquarter of the PCN, then we shall have a governance structure that includes the technical committee from the sub-county who will be health professionals. That governance structure will include a representative from the faith-based institutions. That governance structure will include a representative of the partners. That governance structure will recruit a representative of the community. And lastly, that governance structure will include a representative of the special interest groups, either our mama or somebody living with a disability. What am I doing with this? We want to introduce transparency in how we run our hospitals, our public hospitals. Kenyans are suffering because of wastage of public resources. As a minister, I have said I shall not oversee public resources wastage. So I agree with you, MCA. It is only a matter of time. In a few months' time, we are going to roll out that. We are working together with COG to ensure that we have proper governance structures for our hospitals so that then they are able to manage their affairs. And Governor, we also want to pass an FIF bill that will ensure if the sub-county hospital here, Sabatia, collects funds, then the board will sit down and agree on what they want to use with those funds. Because at the moment, I am sorry, Your Excellency Governor, that these hospitals collect resources, but when they take it to the joint account of the governor, of the county, sorry, not yours, there are different priorities. Pesa imetolewa kwa hospitali, but unaona inajenga barabara. Hospitali inaendelea kukosa dawa. Ama pesa imetolewa hospitali kwa wagonjwa, but the hospital sees like the most important thing is to build a beautiful gate that does not add value to the patient. So now we are going to have a governance structure ya kuhakikisha kwamba hiyo pesa imetolewa hospitali, inarudi hospitalini, kuhakikisha kuna dawa, wafanyikazi wanalipwa, na pia kuna equipment. Ladies and gentlemen, I cannot overemphasize. It has been demonstrated here that partnerships and collaborations in health works. You can see the partnership of CBM, the partnership of the Rotary Club, and all the other partnerships that have been demonstrated here have worked to ensure that this facility works optimally. And for the few years I've lived on this world, I have never heard about misappropriation at Sabatia Eye Hospital. It means partnerships work. Sindio? It also means that the management does a good job. It also means that the hospital has a good health workforce. And during my leadership PCS, I have said the most important asset that we have in healthcare is the health workforce. As your minister, I want you to be treated with dignity, with value, lakini pia nyinyi muajibike kazini. Ama namna gani nurses? Si namna hiyo? Hivyo tu polepole. Nifanye upande wangu, mfanye upande wenu, na wananchi wapate services. So we shall continue as a ministry to facilitate partnerships where possible, and especially we want to achieve universal health coverage. We must bridge the gap that persists in partnerships where resources are allocated but very poor accountability. I am aware also, and from our discussion in the morning with the chair, you have indicated the shortage of the health workforce. I want to assure you that as I go back to the ministry, together with my director here, we are going to sit down so that we get your immediate needs, and I shall address them immediately. In conclusion, ladies and gentlemen, I want to call upon all of us, and the chair of the board alluded to it, that it does not matter what kind of support it is, however little it is. When you can, please contribute to noble causes like such a hospital. And I'm sure that this hospital is going places. Lastly, PCS on the national issues. The last few days, I'm not sure if there's the regular media, but I would like to say that indeed I did say that the government is broke, and it's not a secret. It is. And therefore, we had small challenges and delays on disbursement of funds to the National Health Insurance, NHIF fund. However, I am happy to report PCS, as at this morning, I received a call from Treasury that funds have now been disbursed to NHIF. And now, the facilities, which I'm sure this is one of them, once your claims are verified, you are going to receive your payment. I want to call upon all other healthcare providers that they resume services, those that had stopped, as we process claims and ensure that we make payment. But again, I want to assure you that I am not going to oversee graft. I am going to ensure that we optimally use the scarce resources that are allocated to us. Baloguri, mrembe, mubebalamu, mwayanza PCS, sali mwana wenyu, sili mtoto wa hapa. Ala mimi nakumicha natoka tu hapa ng'ambo hapa tukitale, mimi msichana Bukusu. Na sisi waliwe tukipewa kazi, tunaichapa sawa sawa. Na nataka kushukuru PCS kwa sababu he's my elder, and he has been holding my hand in all the places that we go. Ananiambia Nakumicha, kanyaga hapa, fanya hii, fanya hii, fanya hii. PCS, thank you very much, sir. I appreciate that. Na sisi Wabukusu tunasema courtesy begins at home. Nadhani wazungu walikopi kwa sisi Wabukusu. Na kwa sababu PCS hapa ndio nyumbani, it will be a shame if I don't support him, especially on health indicators. And I want to commit to Balogoli that moving forward, I am going to ensure the health indicators of this county, working together with your governors, are the best. And Governor, thank you that you are doing a good job. We shall work together. All I need from you is a letter telling me what you need to facelift the sub-county hospital. Once I have that request, I'm sure the PCS will support me in cabinet when I say now allocate 100 million to the sub-county. Sinamna hiyo? And all I want, Governor, but what to? You know, we live in a world where you must ask and then be given. Sitaki kuimagine mnahitaji equipment. I want to know exactly what it is that you need. I don't want to imagine that you want maybe to do some infrastructural changes. Please indicate what it is that you want. We shall work together and deliver it within the shortest time possible. And because I honor women, I agree that after we have done what we have done, then we rename the facility to Mama Anna Mudavadi Sub-County Hospital. With those very many remarks, it is now my singular honor and opportunity to invite the son of this soil, none other but His Excellency, the Prime Cabinet Secretary of this